Hello. How you doing? You all right?
Just going through a couple of, I tried to find some scenarios, like at least in the same topics. Yeah, they're quite difficult, this one that you picked up.
Oh, right, yeah. The exam is quite, they do lots of different types of scenarios. So I'm trying to replicate that as much as I can by doing those difficult scenarios like angry patients and stuff. But if you prefer to do more simple ones to begin with, that's fine as well.
Let's do like complicated, because simple would be simple. And like complicated is like a lot of to learn about. So yeah.
Good. Yeah, I think so, because provided that you're comfortable, doing a basic history and management plan, then I don't think it should be an issue. I think if you can do all the difficult, complicated cases now, a lot of it is just kind of your confidence in the exam. If you can approach the station feeling confident, that's probably a good gauge that you're going to do well in the station. Because if you can nail consultation skills, then you're pretty much sorted for the exam. So yeah, this is just kind of the general structure. The academies, they use their grips. So greeting, rapport, introducing self, purpose, and a reminder to smile. I don't know if Dr. does he use the same structure?
Yes, yeah. They're all the same.
But it's all very intuitive. You don't need a framework to tell you how to say hello to someone. But yeah, it's just it's useful, isn't it, just to have that as training wheels sometimes if you do feel like you want something to fall back on. How am I for speed? Am I talking too slow?
No. This week I had such an angry patient. She just was screaming, "Go out from my room!" And I was like, okay, this is the time to show my interpersonal skills.
Yeah, I mean, so these are some of the notes I made, but I think this is the one I live by the most. I find this useful because there's this book by Stephen Covey called The 7 Habits of Highly Effective People. And one of the habits he talks about is seeking first to understand, then to be understood. So when I'm in that situation, I do find it useful personally, I just have that in my mind, just try to understand as much as possible and gather as much information as possible, because I don't want to be in that position where I make any assumptions, because that will just frustrate them even more. So make sure I've got a really clear idea of what the facts are of the situation before I start giving my input. So I think that's kind of something I live by is try to not just with patients, but just in general, seeking first to understand, and then it's once you've really taken the initiative to give them that feeling that they've been understood, that's almost like a psychological oxygen that you give them. They're more likely to be patient afterwards, to actually listen to what you've got to say and take it seriously.
It will definitely work in the exam. I don't think that it will all the time work in real life, unfortunately.
Yeah, that's interesting. I mean, I suppose you can look at how you're seeking to understand. So are you listening with the intent to really understand, or are you listening with the intent to reply? Because if you're listening with the intent to reply, then it's not going to have the same effect as if you're listening really trying to understand their situation, and not from your own frame of reference, but from their own frame of reference. You have to let go of your own kind of personal beliefs and what you would do in that situation, and and judgments, and just kind of really understand what they're feeling. And I do think when you do that properly, it really does make a difference. But it's easier said than done, especially if emotions are riding high and stuff. It can be difficult.
Not all the time, but yeah, you're right, absolutely.
But yeah, that's just the main one I wanted to talk about, really. I mean, yeah, should we just get into it?
I've gone through everything that you sent me, so I'll actually read it.
So yeah, so your foundation year 2 doctor in general medicine ward, an 81-year-old man, Wilson Attenborough, has developed diarrhoea. Wilson Attenborough was admitted 10 days ago with pneumonia, and he has been receiving antibiotics. 2 days ago, he developed diarrhea. A stool sample was tested positive for C. difficile. He's now been shifted to a different ward with other patients with similar symptoms. He's receiving vancomycin and IV fluids. Talk to his son and address his concerns. Permission has been taken from the patient to talk to his son.
Okay. Do we need to set timer?
Yeah, I'll sort out a timer. So usually they give you 90 seconds to read the task, and then the bell will go off, and then you go into the room. And then you'll have 8 minutes to do the station. You'll get a 6-minute warning bell at 6 minutes, so you've only got 2 minutes left. Just to let you know that you need to wrap up now. Yeah, and then you'll get the final bell after the 8 minutes. So what we always say in these sessions, we always say to aim to end it at 7.5 minutes.
Yeah.
So that you can address any concerns or questions that patient might have towards the end. Because that will give the opportunity, if she's got like a script of certain things that she wants to talk about, and anything that's left over, she can kind of fill in the gaps.
Yeah.
Does that make sense? It is so difficult though. Like the GP exams, they give you 10 minutes. Most OSCEs and stuff, they give you 10 minutes. And I do find I always ideally would like 10 minutes to do a proper consultation to keep practicing, so that you can reduce the kind of hesitation, because that does lose a lot of time.
Yeah.
Yeah. Okay then, ready when you are.
Okay.
Begin.
Hello, my name is Anna. I'm one of the junior doctors here in the department. Can I please have your name?
Hi, my name's Peter.
Oh, nice to meet you, Peter. So I know that I've been called to talk to you regarding your father. Am I right?
Yes, yeah.
All right, fine. So how can I help you?
Well, yeah, I mean, to be honest, doctor, I'm not very happy because my father, Wilson, he came in to hospital 10 days ago with a chest infection, and it wasn't like a really severe chest infection. But they thought, they would hospitalize him, and he's been on these antibiotics, and he did seem to get a bit better, but the last couple of days he's developed diarrhea. It's quite aggressive diarrhea. It's going to, he's losing a lot of fluids and stuff, and I am concerned, and that he's come in to hospital, and he's going to come out much worse off. I'm not really happy about what's happened. I'd like to know, what's going on.
Yeah, I see. Yeah, I see, and I can completely understand that it might be quite a stressful time for you, that your father's in hospital and something is going on right now. Yes, your father has been, I can see from my notes that your father has already been admitted for pneumonia, and he has received some appropriate treatment. You've told me that you are not happy about what is going on. Can you please be more precise? What is quite is concerning for you in this situation?
Well, I suppose because they've moved him into this new ward, right? And I've just been looking around, and everyone has got diarrhea. So I'm just a bit concerned that there's a bug going around at the moment in the hospital, in the ward. And what's going on? Is it the food? Has he got food poisoning? Why has he got this diarrhea?
Yeah, okay, I see. It is quite a reasonable question you're asking me. So actually, let me explain you. So your father has received some treatment against pneumonia, okay? But at some point, he developed kind of a side effect from the antibiotics that has been prescribed before. And this side effects is causing him diarrhea. Okay, so actually this is kind of a bug that is growing up in his gut during receiving the antibiotics, and this is kind of a severe condition. That is why he's still in hospital, and we actually moved him to another ward, as far as he should be treated directly in the special department for this newly appeared diarrhea. Am I clear?
Right. So you mentioned it's a special department. So what do you mean? So why is it special?
I don't know. I don't know what to answer. Okay, fine. So actually, this is kind of a department that is, because this bug could be a little bit dangerous for other patients as well. That's why we kind of isolate your father from another patients, and we will make sure in this case that he will be given appropriate treatment and be looking after appropriate kind of a staff who can take care and has special skills and appropriate knowledge how to take care about exactly this side effect. Do you follow me?
Yeah, okay, that's okay, I understand that. Just one question though, because you mentioned about this being a side effect of antibiotics. Is that right?
Yes.
So if this is a side effect of antibiotics, how is it that he's caught, and you also mentioned that he's caught another bug as a side effect of this antibiotic. So how is it that he's been treated with antibiotics where the intention is to kill the bacteria, and now the antibiotics have actually given him another bacteria? How does that work?
Yeah, I can completely understand. It's a little bit like of uncertainty for you, but let me explain you that this is something that we are expecting to get kind of a side effect from any type of antibiotic. And yes, you're right. We have given him this antibiotic against his chest infection, but unfortunately, we sometimes cannot control what is going on inside his guts. So now he is switched to another kind of antibiotics that is fighting against exactly bugs that is growing up in his gut right now. So we make sure that it's covering all of the kind of the bugs that can grow, and it should be helpful for your father. So I do hope that in couple next of 48, 72 hours, he will be getting better. Am I clear? Is there anything else you want to ask me?
Well, yeah, I suppose he's been quite unwell for quite a long time now, and he's been staying bedbound for quite a while. So I was just wondering, because my dad, even though he is 81, but he is quite independent for his age. He lives alone. He gets around and does lots of stuff. He's very fit and active generally. And I'm just a bit concerned because he seems a bit weak now. So I was just wondering, if he does come through this, like you said, you're expecting him to come through. Is there any way that you can help support him get back into living kind of his independent life again?
Yes, absolutely. So what we are going to do, first of all, we are going to make sure that your father is quite healthy, and his general health is okay to let him go home before being discharged from hospital. Moreover, in case if he will be still feeling weak, but his clinical state would be allowing him to go home, I would suggest arranging for him some kind of an occupational health. Oh, sorry, occupational health. Okay, fine, whatever. I will not occupational. Okay, so a kind of a team who will come to his home and assess how he could cope on his own at his home, or if he need any help from any nurse or anybody else to get along with his daily activities. So we will make sure that we will arrange it before discharging him from home. Okay.
Great. Yeah, that's really nice. Yeah, I think he might need that. Thank you.
Okay. May I clarify? Is he living alone?
He is. Yeah.
All right, fine. So I will make sure that we will do this before discharge. Is there anything else you would like to ask me?
I mean, I suppose, can I visit him?
Yes, absolutely. But I would say that for the nearest 72 hours, your visit is limited and restricted because we need to make sure that he is not dangerous for your health as well. So he cannot he is not able to pass this bug for you. Okay.
Right. Okay.
Okay, fine. So I think we're going around of time. It was horrible. Oh my God.
Move on to the next station.
To be honest, I never have this patience, and I don't know, as they should be isolated or no, but I suppose they should be isolated. I suppose that they cannot be visited.
Yeah, I suppose you know how they have those isolation rooms. where you have to wear a gown and gloves to go in to enter.
Mm,
The thing is that he's been put into a ward with C. difficile patients, right?
yeah.
So I think whilst during the active phase, it might be that they put him into one of those rooms, one of those side rooms, because he's already in a ward with other C. diff patients. I presume it's okay. The main things really are like, you know, if he is going to, you know, wants to see his dad, he needs to hand washing with soap and water, not with alcohol gel, because this is resistant to alcohol. And yeah, I think that's the main thing really. I think, but yeah, he's already been kind of isolated with other patients with C. difficile, so it's not a huge issue. But yeah, I mean, like, yeah, it's a tough one, isn't it? Because it doesn't give you kind of a way to structure it. It's just kind of, you know, talk to his son and address his concerns.
Yeah, I'm just wondering, should we follow any structure in this case? I mean, like, now I'm thinking about, like, should I just tell something like, oh, like maybe take some history more, or was it appropriate? Because I just run to like, oh, I see from my nose, and as it is, should I just ask about?
Yeah, I think also, you know, starting with an open question at the beginning about what's been going on. What was the open question you asked before? Was it, did you ask me what have they told you so far about his condition? Or no? Yeah, I think there might have been an open question missing at the beginning, so that you know the patient can guide you as to where to go, and you can address that before you move on to your agenda. Right. Do you know what I mean? So you start off with the patient's agenda with the open question, address anything there, and then you can kind of move on to your agenda. So I would definitely start with something like, you know, can you tell me a bit about, you know, from your perspective, what's happened so far, or you know, can you tell me how he's getting on? Yeah, but what do you already know about what is going on? Like what information you have at all? Yes, that's a good way to start it. Definitely, yeah, but definitely one of those open questions. And then and then I would, you know, do your empathetic response like you did, and so you know how like they've got the EVE protocol, so it's just a framework that's to kind of make sure that, you know, we are exploring emotions enough. So EVE, so EVE protocol, E for explore, V for validate, and E for empathize. So the explore would be like, oh, I can see that. You know, you're really quite frustrated about this. So, you know, I completely understand, you know, why you'd be upset about this kind of situation. It's really unfortunate what's happened to your father. So, you know, I'm really, really sorry what's happened. This shouldn't be happening. Something along those lines. So that kind of covers you. So exploring the emotion, I can see that. And then whatever emotion they've got, frustrated, angry, or whatever, upset. And then, you know, to validate it. So, you know, I completely understand why you'd be upset in this situation, and then emphasize, you know, it's really unfortunate what's happened to your father. So you might find that useful. I don't know. I tend to, I do like my frameworks and stuff, just because I think in an 8-minute scenario where you've only got such a short period of time, it is useful to lean back on those kind of things so that you've got a really quick autopilot response, because the time is such a big issue in this exam. That sometimes those things can help. And then after that, showing empathy, I would just move on to explaining, you know, what's happened from my perspective. So about the C. difficile, so the stool sample has been taken, explain that it's tested positive for C. difficile. You explained about the side effects. It's being a side effect of the antibiotic for treating the chest infection. I asked you a question then about, you know, it being counterintuitive. How is it that you give an antibiotic and then he still develops an infection after being given an antibiotic? Like that seems a bit counterintuitive. And I felt like you didn't really explain it at that point. Like I was looking for something along the lines of, you know, it destroying the flora in the gut, so that, you know, the antibiotics not necessarily being that selective. And so whilst they did help to reduce the bacteria in the chest, they also you know, reduce the flora, which are the good bacteria, which help defend you against these kind of invading microorganisms like C. difficile. That's how it works, is it will invade the gut when the good bacteria are in low numbers. And that's why this particular microorganism is often associated with antibiotics. So yeah, that's so just a bit more kind of like an explanation, so he kind of understands what exactly has happened there, because he's a bit confused about, you know, the antibiotic thing. And just one thing they do like to, I was watching a video the other day about it was a mock station for CSA, the GP exam, but it was talking about how all C. difficile incidents have to be reported to NHS England. So they have to do a root cause analysis and a really detailed investigation. It's about a 10 to 12 page report, and they have to submit that to NHS England. When that's ready, you can suggest to the relative that you can send them a copy to give them an idea about, you know, what the result of that investigation was. If he's interested in, you know, what caused it and what changes we've made to try and reduce the risk of it happening again.
Yes. Yeah, it's a good point. Yes.
You know, if you've got time, you can mention it. If not, then it's not a problem. Yeah, and you were optimistic, because it is common, isn't it? This side effect of antibiotics, having diarrhea. They do usually resolve with vancomycin or metronidazole within a few days. So we are hopeful that, you know, he will get through this. So I asked you about the deconditioning, because he's bedbound for quite a long time, quite unwell, and about reach. You answered that really well about the. You weren't really happy with your answer for some reason, but I thought you answered it really well.
Not called occupational health, it's called like
occupational therapist.
Occupational
it's confusing, isn't it, the two? Yeah, they are different, aren't they? It is confusing. So when you were working, you know, when you were first applied for your job and stuff and got your job, then you had to go through occupational health, right? To check you're vaccinated and everything. But so yeah, the occupational therapist.
You're so familiar with NHS system.
So the occupational therapist, they'll be involved in kind of making any adjustments at home, you know, and at work as well. There is an overlap though, because they do make, you know, look at ways that you can make adjustments at work as well. So it is confusing, because they are like, they've got the same name obviously, and so it's not just about the home as well. So it's also about work, seeing, you know, like for example, if someone gets carpal tunnel syndrome or like got rheumatoid arthritis or something, and they've got an office job and stuff, so like doing like designing the equipment ergonomically and stuff like that, they'll be involved with stuff like that. The occupational therapist, and the occupational therapist would also be involved in, you know, like elderly people at home, giving them installing stair lifts and you know, in the kitchen, making sure everything's reachable and stuff like that.
What happened with me, my brain just forget this like occupational therapist and just release occupational health. I don't know, because my English language is not my first language. That's why like I sometimes can just say some stupid things like, oh my God, like what's going on? Yeah,
I think that was the main thing. I mean, we did one earlier today with somebody, and I did ask him the same question, and he didn't pick up on the kind of the rehab thing. That's like the answer I was looking for. Right, so you know, like the rehab and that kind of care package. So once they're medically, like you identified what it was exactly. So once they're medically fit for discharge, then they would do like a multidisciplinary assessment. I can't remember exactly what it's called. Like it's some kind of like care package, like a discharge package. And it would depend on so they'll do an assessment, and it would involve, you know, occupational therapists and social workers or whatever, or physiotherapy and things like that. And then they would see, it may be that they need, you know, just somebody to come and visit them, to pop in every now and then at home, and to provide some kind of care or of some kind or support. Or it may be that they put them in like I can't remember what they call it, it's like a halfway house kind of thing. So they'll put them there where they've got a bit more support, and then they'll transition then into living more independently like they were before. So yeah, but that will all be them. So once they're medically fit for discharge, they're fit for discharge, so then they're ready for to be seen by you know, that whole team. Yeah, that was really good. Yeah, and just the main thing is, you know, like obviously he's got diarrhea, so keeping him hydrated with fluids and monitoring. make sure it doesn't deteriorate.
Yeah.
See if there's anything else on my notes. That was the main thing. I mean, you picked up, the only other thing is, you know, sometimes with these kind of angry relatives or angry patients is suggesting PALS. You know about PALS?
Yes.
PALS, yeah.
But I heard like that actually we are not supposed to suggest it unless they ask for this.
Yeah. I mean, it's difficult because what you're going to do in the exam is different from what you're going to do in practice. In practice, you don't want to encourage people making complaints, right?
No,
because
in exam as well. I think in exam as well.
Oh, right.
Yeah, I've heard
Okay.
some couple of like recommendations that like unless they ask like I want to complain or whatever, like you are
Right.
not suggesting they make complaints because like they don't want you to make complaints.
Oh, okay. All right, fair enough. Yeah, okay. The aim is to come to resolution now
Yeah.
in this consultation, and if you
Yeah.
want, then you can progress it to PALS as a
Yeah.
last resort. Okay, yeah, that makes sense. Yeah, that was it really.
Yeah.
Yeah. Have you been practicing much of these stations at all?
No, I practiced 3 times.
Oh, did you? That's good. Well, it's quite
My-
early, isn't it? So-
Quite soon. My exam is quite soon, and I'm just so bad in practicing. I need to take it. Yes, I need to schedule it a little bit better. Yeah. Okay.